an abbreviation for urinary tract infection. The word infection, I think people understand, but maybe what needs a little bit of explanation is urinary tract. Urinary tract means to begin with, the urethra. People know the urethra, where urine comes out. There is a short tube for women, a longer tube for men. That tube, which connects with the urinary bladder, is called the urethra. It's part of the urinary tract. The bladder is where urine is stored before it is conveniently voided. The bladder is like a sac. So the urethra connects to the bladder, and between the urethra and the bladder there is a valve which we call a sphincter, which controls the urine. When that sphincter doesn't function well, urine will flow without control, and that is a very uncomfortable situation. So you have the urethra, which I have explained. You have a sphincter, which connects between the urethra and the bladder, and then the bladder, which stores urine. This urine is generated by the kidneys. The kidney is an organ which cleans the blood and collects urine. And between the kidneys and the bladder, the urinary bladder, you have what we call ureters. In biology, you remember these things, ureters. They are also tubes which connect the kidney and the bladder. So the kidneys, the ureters, the bladder, the urethra, they constitute that system called urinary tract. So when there is an infection along that system, that is the urethra, the bladder, the ureters, the kidneys, we talk about urinary tract infection. So that is, and these infections can be caused by, most of the time it is a bacterial infection, certain types of bacteria, especially E. coli. E. coli is a bacteria that is commonly found in fecal material. You know, feces, stool, poop. And the urinary tract and the digestive system are very closely, you know where the urethra is and where the anal canal is, the anus. There's a very short distance, and sometimes the urinary tract can be infected by E. coli from the anal canal, especially if someone is not clean, and especially for females, because urinary tract infections are common among females because the urethra is short and rather wide for females. For males it is longer, and so the bacteria may not find it very easy to climb up a long tube, but a short wide tube for the females. So the urinary tract infections are common among females, but that doesn't mean that it doesn't affect males. It does affect males too. And the other question was
how to prevent.
How to prevent?
Yes.
First of all, general hygiene. We must keep ourselves clean. For me, when I go to Susu, we tell people, wash your hands after Susu. When I go to do Susu, I wash my hands first, touch myself, do the Susu, and then wash after also. Now, most people wash after. But if you touch your genitals with dirty hands, that also is not good. So general hygiene, people bathe. Here you have plenty of water. You can bathe easily twice a day without any problems, in the morning and in the evening. But if you, for the females, when you are in your periods, you could even wash 3 or more times a day because it's possible. The water is there, the washrooms are there, so you can do that. So general hygiene is very important. What you wear is very important for the girls especially, but also for the boys. Don't wear nylon things, wear cotton fabric, because cotton absorbs easily moisture and the body rarely reacts to cotton because it's a natural fiber. The other fibers are unnatural. Don't put on very tight things, because when you put on very tight things, your body is not breathing, it's not well ventilated. That's not how God created us. Actually, God didn't create us with clothes. He created us naked. I'm not saying people should walk around naked, but when you dress, don't be too tight, and use cotton preferably, and drink plenty of water, because the more you drink, the more your body is washed out. You go more frequently to urinate. One of the factors that may lead to a UTI is when urine is kept in the bladder for a long period of time. So the moment you feel like passing urine, go and pass it. Why do you keep it there? Because it's dirty water from your body. It has a lot of dirt, and bacteria will easily thrive there. So the moment you feel the urge, go and empty it. Now, you may not feel the urge if you don't drink enough. But if you drink enough throughout the day, the doctors tell us a minimum of 3 liters of water, but you can even drink more, especially when it is hot or when you are very busy and very physically engaged and you are sweating. You can even drink more, so that you go more frequently to urinate and empty the urinary tract infection. But there are other conditions that may lead to UTIs, like if someone has diabetes or any other infection that weakens your body, your urinary system is one of those systems that may be affected and you get infections. Now, also sex. If you have sex with someone who has an infection, it may end up in the urinary tract and cause an infection. So here at UCU, we tell young people like you, the smart thing is to abstain. There is nothing that beats it. We know it's difficult, but it is possible. And it is the smarter thing. So me, I tell young people, the difficult things are the better things. And abstaining, there's no way you are going to get, for example, sexually transmitted infections if you don't have sex. Where will it come from? And the UTIs, they can come without sex, but sex can increase the probability of you getting these urinary tract infections. And they can be very uncomfortable, because when you get a urinary tract infection, you can get fever, you can get frequency. Frequency means every time you want to go to the loo to pass urine, and then the urine can be painful and you can lose control. When you have an infection and that valve between the urethra and the bladder can be weakened, and the urine now begins flowing out without your control. You don't want that to happen to you. So fever, painful passing of urine, frequent passing of urine, general body weakness, pains especially in the loins, all those are signs of urinary tract infection. And if not treated, that's a disease which can even kill a person easily. So when you feel any of those signs and symptoms, especially fever, painful passing of urine, frequency, go to Iron Galloping or any other place that has trained health workers, and they will help you. Normally they take off a sample of urine, examine it under a microscope, and they will tell whether you have a urinary tract infection or not, and the treatment is available. UTIs are one of the top 3 common reasons for going to Iron Galloping. It's It's very common among young people in this community, especially young women. I think I've given you all the information.